Hi, I'm Wendy Maurer. I'm with Cole Health, where we offer ABA therapy, speech therapy, OT, and pediatric therapy. We are very excited today to have one of our favorite providers here with us, Dr. Koshy. And so he is going to go over some really great, insightful tips for us just to know what to do during this time. So thank you for joining us today. We're so happy to have you here. And so could you just kind of share with us in the community what it is that you do?
Sure. So I'm a developmental and behavioral pediatrician. I work here at the UT Physician Center for Autism and Related Conditions. And so I'm the medical director here. We do primarily diagnostic evaluations for children for all types of issues, but one of the most common reasons we get referrals are because there's a concern of something like autism spectrum disorder or another developmental issue. So we do that initial evaluation and we help parents connect to services, although we don't do those services. So that's where we often connect to you guys over at Cole. So thank you for what you do.
Oh yeah, we love having that relationship with you. And so we know things have changed obviously with COVID. Can you kind of explain to us what you've done differently in your office and kind of just what changes has happened for you?
Yeah, I think the biggest change is that we are doing a lot of telehealth at this point, and we were never doing it before, although we wanted to. But with everything going on, we made that switch, and I think it's been really interesting because I think I get the question a lot about, well, how are you going to do an evaluation for my child if they're not physically with you? And my answer is basically, well, if you were here, I'm still going to talk to mom, dad, grandma, whoever is there, whoever is taking care of that kid, for you to tell me what's going on. And so that hasn't changed. We're still getting as much information as possible from the people who know these kids the best. But the other positive is that we're watching children who sometimes have a really hard time coming into our clinic because they know they're at the doctor's. We've eliminated that. Now they're at home where they're the most comfortable. So interestingly, I think we are getting, even in some ways, a better picture of what that child can do, watching them at home with their family. So that's probably the biggest thing that we've done to change what we do. And it's all about keeping our patients safe and also our staff.
That's so cool to hear. We've kind of had the same feedback where it's like seeing our patients in their natural environment where you're like, oh my gosh, they do not act like that in the clinics. So it's been a huge eye-opener, and I hope it's a service we continue out afterwards too. So in speaking with families that you work with, when you notice as a parent, if you're noticing a developmental delay or any type of disability, what are the first steps you recommend for families to do?
So I think a really good step is everyone has a primary care provider, so pediatrician, family medicine doctor, whoever that is. I would talk with them first because that's often a really great place to figure out, like, is this something I need to worry about or not? But I put a caveat there that if a parent feels like they're not getting heard by that provider, then you need to figure out who else to talk to. And maybe that's a teacher, maybe that's a therapist, if you have a speech and language therapist you're working with. So trying to get more information to understand what's going on. And it may be that things look different from someone else's perspective as opposed to the parent, and that's okay, but it's good to know what everyone else is seeing as well.
Yeah. And so we, as a parent myself and you too, there's just so much stuff out there right now. And it seems like every day people are like, do this, do that. But so if for just to give you that platform, what are 3 things that you would recommend for parents to do during this time just to make sure that their child's still hitting those developmental milestones and all that fun stuff?
Yeah, so definitely stick with your regular well child visits, because when you go to your pediatrician, that's when they do the screening. So I absolutely understand that there can be some real fear about what's going on and not wanting to expose your children to potentially to COVID by going to the doctor's office. Mm-hmm. But what's great is doctors' offices are prepared. So everyone's masked. It is probably going to be the most safest place to go because that is their priority, not to get children sick. So continue with those routine well-child visits for sure. Staying connected. So, I think at times we can end up being really isolated, and that can cause a lot of stress. And so if you feel like there could be something going on, talk to someone. And maybe that's even just a family member or a neighbor or a friend. And then get informed. I think that's really important. There's not a lot going on in a lot of ways. So this is a great time that if you think like, oh, well, my pediatrician raised a concern about autism, maybe now's a good time to maybe look into that. What does autism mean? Because I think that's such a huge word, and everyone has a different version of what that means in a sense, until you're very familiar with it, and then you can kind of see all the ways that autism spectrum disorder can appear. But sometimes that can be a very heavy term if it's used for the first time with the family. So take the time now and look into that.
I really like how you pointed out the well child checks, because I've seen parents say, I don't feel comfortable. And I'm like, you still got to keep up with these daily routines, because it's, those are the milestone markers and everything. Yeah. So in keeping in touch and with timelines and stuff like that, if you're a pediatrician or a developmental specialist like you recommends out therapy at this time, what do you recommend for families to do? Do we continue and follow in with that plan of care?
I mean, as best as possible, the answer is yes. But, the caveat here is every family has to make the right decision that works for them. So sometimes that means teletherapy is a great option. Maybe it means, no, you actually need a therapist in the house, or you need to go to a center that's doing therapy on site. So I think it just really depends, and it's not an easy answer. But as best as possible to continue with some version of the treatment plan, that would be best. But so much easier to talk about than to actually do. So
I know, very much. And then when you look at children that have developmental disabilities and the social distancing component, a lot of parents sometimes feel, well, they're at higher risk, what are some things that parents can do, like you mentioned before, just continuing in with their development, that routine and everything? And
yeah, I mean, I am not going to be the person to tell a parent what to do during this pandemic, because I think it's so unrealistic for, because and you know this, parents will do anything. They will do literally everything they can do. But I think it's really a challenging time to expect parents to work from home, also be the therapist, also be the teacher, and also be the parent. And I think the best advice I have is for parents is to try to incorporate moments into the day. I mean, to sit and do therapy for an hour, I think sometimes that can be really challenging. And parents are not trained to do that. And you're not supposed to magically be able to convey an hour's worth of therapy. But maybe there's an exercise the therapist can advise the parent to do during a diaper change. Or maybe there's an activity the therapist or teacher can implement with the parents' help during mealtime. So kind of building something into a routine where it kind of just happens and you're not having to sit and do therapy. I think that might make it a little bit more tangible and realistic than sitting and doing like all of the tasks that the amazing therapists can do, but that's because that's their field. They can do that.
I really like that more holistic approach and just making it natural. And so what are some of your favorite resources you would recommend parents to look into?
Well, my new favorite resource, interestingly, is the Zoom webinar you're doing, because I heard that talk and I thought I learned so much from you. So I thought that was amazing. And I know you do that for our trainees here in the medical school. So I love that you're offering that. So hot off the press, that's my favorite resource. And I also know we share some common ones. I really like, I think sometimes when parents are looking for information, if we don't give specific places to look, then you have the whole internet and it can be completely overwhelming.
Oh yeah.
So if for things like autism, I sometimes will refer to the Autism Speaks website just for content to kind of get some familiarity. I love certain groups like Family to Family. I know you have them on your list, but I love that group as a networking opportunity and like a local resource. And then all the kind of state organization where you can get information about resources, which you very nicely cover in your talk. So I think that those are probably my short list.
Well, I feel so honored that we're on the top of the list
Oh,
there.
you're on the list, trust me. That I learned a lot from that talk just by watching you, but I knew that. So it's good that other people get to learn that as well.
Yeah, and I feel like just connecting with families in the community and having that as a standing webinar is going to be a great thing for us to build on. And so to end everything, I guess, thank you. And how can families get in touch with you if they would like to look into your services?
Sure. So they can find information about our clinic on the Children's Learning Institute website. It's a really long name, but it's www.childrenlearninginstitute.com, I think. Might be .org. I should probably know that. The other thing is usually talk to your pediatrician. Most of our referrals, the best way to get into our office is for your pediatrician to provide a referral, because we want to make sure we're the right fit. And I think, you know this as well, just because we work with certain populations doesn't mean we can address everything under that giant umbrella. So if we're a good fit, your pediatrician will definitely help to make that happen. But talk to your pediatrician and get them to send us a referral, and we'll do everything we can to get everything sorted out.
So awesome. Well, thank you for your time, and thank you for your insight. And you did a beautiful job. I mean, just listening to you as a parent, I do not feel overwhelmed hearing just a slew of things to do. I really like your holistic approach, and that's just why you're one of our favorite providers to work with. So thank you very much.
Happy to do it, Wendy. Thanks for all you do.
Bye.